Hello friends, welcome to the class. So today we are going to talk about skeleton. So we completed basic important things related to the bones in previous classes. Whatever the important things we need to know about the bones. So we talked about function of the bones. We talked about types of the bone tissue, classification of bones, and then afterwards we talked about embryonic growth, how the bone grow. Okay, everything we discussed. Then afterwards, what are the main things to know about the growth of the bone? Okay, what are the factors? How to maintain the bone constantly healthy? What are the things we need? We need hereditary things. We have to know about the nutrition value. We have to great hormonal balance. Then we need exercise. Okay, so these are the four important pillars of the bone. Okay, these are the four important pillars for the growth of the bone: hereditary, nutrition, hormones, and exercise. So whenever I request you that whenever bone related issues or any degenerative diseases which are related to the bones, first of all, you have to know this history of the patient. How about his family history? How about his nutritional diet? Third thing, ask them related about their hormones, if they have any uh, endocrine diseases like sugar, okay, or kidney diseases, liver dysfunction, anything. And the four most important thing, if everything is in balance, is he doing exercise? Okay, so this is the base of every bone disease. Let's talk about the skeleton. So basically we know that we have this in the skeleton we have two division. One is axial skeleton and appendicular skeletons, which support the appendages or limbs. The axial skeleton consists of skull, vertebral column, and rib cage. What is axial skeleton? Axial skeleton is skull, ribs, vertebral column, and this hip. Okay, everything will come under skeletal axial skeleton. Okay, the bones of the arms and legs and shoulders and pelvic grills make up the appendicular skeleton. What comes appendicular skeleton? In the appendicular skeleton, we will get arms, both upper limbs and both lower limbs and pelvic girdle. Okay, this will come under appendicular skeleton. Many bones are connected to other bones across joints by ligaments. So we have to know that this is the bone, this is the bone. Two bones are attached by one powerful fiber that is made up of connective tissue, fibrous connective tissue that is known as ligament. What is name? Ligaments. So both bones are connected by one fiber connective tissue that is called ligament, which is made up of fibrous connective tissue. Okay, which are strong cords or sheets fibrous connective tissue. Okay, the importance of ligaments become readily apparent when a joint is sprained. A sprain is the stretching or even tearing of the ligament of a joint, and through the bones are not broken, the joint is weak and unsteady. We do not often think of our ligaments, but they are necessary to keep our bone in the proper position. So why we need ligament? To keep the bone on his position. Okay, so whenever sprain occurs, so when you hold any heavy weighted things or anyone drag you, so when happen that the ligament tear will happen. So whenever you will get the hand up, when you will rise your hand, so you will get the pain. Okay, so we need the ligaments because to put the bones on the proper position. So okay, so how many bones are there in our body? we have 206 bones. So I told you that in the baby we have 300 bones, but gradually the bones are fused and they will become only in the human adult we have 206 bones. Okay, so let's start the first with skull. So skull come under axial skeleton. So first of all, we will talk about detail about skull. So skull have 8 bones. How many bones we have? Basically, skull have 8 cranial bones, and in the skull we have everything. We have face, we have crania. Two things are in the skull. First is crania, and another thing is face. So in the crania we have 8 bones, and in the face we have 14 bones. So how many bones total? Total we have in the skull 22 bones. Okay, we have 22 bones in the skull. So you need to know about this, that in the bones we have, in the skull we have 22 bones. Also in the head are 3 small bones in each middle ear cavity, and the hyoid bone that supports the base of the tongue. So other than this, we have 3 plus 1 small bones which present in the ear and on the tongue, or which supports the tongue. Okay, which bone which supports the base of the tongue. Okay, this, if this is the tongue, so this tongue is connected to the bone that is called hyoid bone. Okay, so basically you have 22 plus 3, 25, 26. So if we count the bones, we have 26 bones in the skull. Okay, in the skull we have 26 bones, 8 bones in the crania, 14 bones on the face, 3 bones in the ear, 1 bone to support the tongue. The total 26 bone. So let's talk about each and every bone in detail. The cranial bones. First we will talk about cranial bones. Form the brain case lined with the meningitis that enclose and protect the brain, eyes and ears. The names of some of these bones will be familiar too. They are same as the terminology used to describe area of the head. Okay, so basically what did cranial bone do? So basically this is the skull. Okay, this is the whole skull. This is the skull. In the skull we have cranial bones, facial bones, ear bones, and one tongue supported bones. So basically, this is the crania. This is the crania. What the use of the crania? First, we have inside this we have brain. It protects the brain as well as eyes as well as ear. Okay, so crania protects the eyes, crania protect the bones, protect the brain, crania protect the ear. So this is the main reason we have skull, as well as the brain have 3 layers. Okay, we'll study in the nervous system. Those layers are known as meningitis. What are the name of the layer? The name of the layer is meningi. We have 3 layers, okay, which covers the brain and protect the brain, and as well as in the brain or top of the brain or in the layering of the brain is the meningi. We have CSF, cerebrospinal fluid, which make the brain, its weight is very less, okay, and as well as it have glucose quantity. For emergency purpose, the glucose will take the brain from CSF only, and it have proteins and other substance also. Okay, so let's first talk about cranial bones. So we have 8 cranial bones. What are the names of the cranial bones? We have frontal bone, we have parietal bone, we have temporal bone, we have occipital bone, we have sphenoid bone, we have ethmoid bone are part of the brain case and the orbits for the eyes. Okay, first we have frontal bone, parietal bone, temporal bone, and occipital bone, sphenoid bone, ethmoid bone. Okay, let's talk about each and every bone in detail. First is frontal bone. Frontal bones, frontal is, we are getting the idea. This is the front part of the bone. Okay, form the forehead. Why this is the forehead? Okay, you can see that this is the frontal bone, anterior part of the top of the skull. Okay, so the frontal bone, how many bones are there? We have only one bone. This is the frontal part. This is the reason we have one bone. Then we have parietal bone. Parietal bone form the posterior top and much of the side walls of the skull. So this is how many parietal bones are there? There are two parietal bones. So let's see in the image cranial bones. Okay, so this is the frontal. You can see here. So this is the parietal. So after the frontal bone, uh, this is the notch. Okay, notch type like structure. Okay, and this is the parietal area. Okay, in that we have, if we see from the top view, anterior view, we will get two bones. How can see here? Will is there any image from the top view? Hello. Yeah. So you can see here. So from top view, this is the frontal bone. Okay. This is the parietal bone. So this is the, you have two bones. Sorry, this is the frontal bone. Okay, this is the parietal bone. We have two bones. We are seeing this junction here. This junction is known as suture. Okay, suture like structures, we have sutures. This is the frontal bone. This is the parietal bones. So let's come to our here. So parietal bone. Then we have temporal bone. Temporal bone on the side of the skull contains external auditory meatus, ear canal, a middle ear cavity, and the inner ear labyrinth. So what does uh, oh, so what temporal bone have? Temporal bone have eye, ear, sorry, ear. Whatever the ear things we have, we can see in the temporal region. External auditory meatus. So ear canal we have, middle ear cavity. So everything is near the temporal region. So frontal bone it is parietal bone. This is temporal bone. Okay, and the last is backside of the skull, that is occipital bone. What the name of that is occipital bone. The from the lower posterior part of the brain case, its foramen magnum is a large opening for the spinal cord, and the two condyles on the either side articulate with the atlas, the first cervical vertebrae. So we can see in this image that this is the occipital, this is the parietal, this is the frontal, and this is the temporal. You can see here, this is the earway. Here, you can see in this area, you can see ear canal, okay, ear cavity, okay. auditory muscles, etc., etc. This is the occipital bone. So occipital bone, you can see here, this is the superior view. Okay, in this, this is the superior view. This is the occipital bone. This is the frontal bone. This is the temporal bone. Okay, so this is the, you can see, this is the occipital lobe or occipital bone. Okay, in this we have foramen magnum area. This hole is known as foramen magnum. In this, the spinal cord enters. Okay, or brain stem. It can come from this area. Okay, and that the first vertebral columns, that is C1, which is attached in this area. This is atlas. Okay, atlas is attached to this area. This is the foramen magnum. You can see this is the two condyles. This is called condyles. Okay, we have occipital condyles. This is the occipital condyles. The atlas which attached here, C1. Okay, C1 will attach here only. Next we have sphenoid bone. Sphenoid bone is said to be shaped like a bat, and the greater wing is visible on the side of the skull between the frontal and temporal bones. So where it is present, it is present in between frontal and temporal bone. Here we have the sphenoid bones. The body of the bat has the press called the sella turcica, which includes the pituitary gland. So let's see the sphenoid bone here. You can see here, this is the sphenoid bone. This is the sphenoid bone. This is occipital, temporal, frontal, and this is the sphenoid bone. Sphenoid, near the sphenoid bone have, you can see that is, you can see the depression called sella tertiaria, which enclose the pituitary gland. So this is having the area nearby pituitary gland. Okay, next we have ethmoid bone. Ethmoid bone is a vertebral projection called the crista galli that anchors the cranial meningi. The rest of the ethmoid bone form the roof and upper walls of the nasal cavity and the upper part of the nasal septum. Okay, you can see here the ethmoid bone. The ethmoid bone is near the meningi. Okay, and which will make nasal septum. Okay, you can see, and this one. This is the ethmoid bone. This is the ethmoid bone. Okay, in this view, you can easily see. Okay, this is the ethmoid bone. You can see there. And the other form, facial bones. Okay. This is this green part. You can see that ethmoid bone. Basically, it is nearby our nasal cavity. Okay, this is nearby nasal cavity. Okay, so these are the things you have to remember in the uh, cranial bones. So let's revise one more time. We have frontal lobe. Okay, this is the frontal lobe. Okay, we have this is the temporal lobe. This is the temporal lobe, and in the side we have parietal lobe, occipital lobe. This is the temporal lobe. This is the sphenoid bone. This is the ethmoid bone. Okay, this is the, here we have the ethmoid bone internal. Okay, next we have all these bones are the joints between cranial bones that are called sutures. Okay, these are the bones connected with type of sutures. Okay, it may seem strange to repair a joint without movement, but the term joint is used for any junction of two bones. Okay, basically, whatever we call the joint, it means that movement. You can see the movement, but some joints doesn't have the movements like our skull. Skull is fixed joint. Okay, fixed joint. In that, two bones are get together and immovable joint. That is immovable joint. In a suture, the serrated or sawtooth edges of adjacent bones fit into each other. These interlocking projections prevent sliding or shifting of the bones if the bone is subject to a blow or pressure. So we have this type of sutures. So why? Basically because whenever you can get the injury, okay, it is very strong. So that's the reason the our cranial bones are attached by these types of sutures, joints. Okay, because of two doesn't move in his place to protect the brain very confidently. Okay, coronal suture between the frontal and this is one example you can see here suture where here. Here, this is the suture, coronal suture. What is the name of the suture? Which attach parietal bone and frontal bone. This is the name of the suture is squamosal suture. Okay, this have lambdoidal suture. This is the lambdoidal suture. Okay, every joint have their own suture. Okay. Not visible in the sagittal suture, where the two particular bones articulate along the middle of the top of the skull. All the bones of the skull, as well as the large sutures as shown in figure, their anatomically important parts are described in 6.7. So basically, every bone which is in the cranial bones, so it is joined together by the suture only. Okay. Next, we have facial bones. So we completed skull bones. In the cranial bones, we have 8 bones. Frontal, 1 bone. Parietal, 2 bone. Occipital, 2 bone. Sphenoid, 2 bone. Ethmoid, 2 bones. If we calculate everything, you can get 8 cranial bones. Next talk, we will talk about facial bones. Facial bones, only the mandible is movable. It forms a condyloid joint with each temporal bone. So basically, in the facial bones, only one bone is movable. What the name of the bone? What is the name of the bone? Mandible. Lower jaw. This is the mandible. You can see this is the mandible bone. This is the mandible bone. Your lower jaw is movable. Huh? You can open it. You can chew the food, you can drink the water, you can eat the food. Okay, you can cut the pieces. Okay, everything you will do with the help of this mandible. Lower jaw, this is the upper jaw. Okay, this is the upper jaw, this is the lower jaw. So then the other jaw name is maxilla. Maxilla are the two upper jaw bones which also form the anterior portion of the hard plate. Sockets of the roots of the teeth are found in the maxilla and the mandible. Okay, next this is the mandible, this is the maxilla. What is the name of this bone? So we have mandible and maxilla. This is the upper jaw. Okay, this is the lower jaw, which we have attached the teeth. Okay, and as well as we have a hard palate inside the mouth, above the tongue. Okay, posterior to the tongue, that is hard palate. And in the lower jaw we have soft palate. This is the hard palate. You can see here that this is the hard palate. Okay. Next we have the nasal bones. Very important. You have to remember that because Number of patients will come into your clinic with the complaints of sneezing, cough, sinusitis, everything which is related to the nasal bones. Near the nasal bones, we have the very sinuses are there. Number of sinuses are there. We will talk about. Okay. So nasal bones. Nasal bones form the bridge of the nose where they articulate with the frontal bone. So facial bones in the mandible and maxilla, they are connected to the mostly with temporal bone. And this is the temporal bone. So mandible and maxilla is connected to the temporal bone, but nasal bone this connected to the frontal bone. Frontal bone. This is the frontal bone. This is the nasal bones. Nasal bones are connected to the frontal bone, and mandible and maxill this connected to the temporal bone. So we have to remember that there is a lacrimal bone at the middle side of each orbit. The lacrimal canal contains the lacrimal sac. So this is the nasal area. This is the nasal area. Okay, this is the nasal bone. This is we have the lacrimal bone also. Okay. This is the in this area we have the lacrimal bone. You can see here. This is the lacrimal bone. This is the lacrimal bone. In that we have lacrimal canal. Lacrimal gland is also there, which secretes lacrima. Lacrimal gland. Okay, which substance? Whenever you will get the tear with the help of this gland, which keep the eye moist. Okay, now the lacrimal glands for the tears. Okay, so this is the nasal bone. Okay, this is we have the lacrima. This is the lacrima. Lacrima bone secrets have lacrimal gland which seeks. That's the reason it is nearby the ear. Okay. Each two zygomatic bones form the point of the cheek and articulate the maxilla, frontal bone and temporal bone. Zygomatic bones. This is the zygomatic bones you can see here. This is the zygomatic bone. This is the zygomatic bone. Okay, which connected to the maxill. This is the maxill. This is the zygomatic. This is the zygomatic bones. So we have one, two zygomatic bones, and also connected to the mandible. This is the mandible, this is the maxilla, this is the nasal bones. Okay, this is the lacrimal bones. Each is connected to the temporal bone, but nasal bones are connected to the temporal bone. Okay. Next, we have the two palatine bones, are posterior portion of hard palate. Okay, you can see here. This is palatine process. This is, and we have the palatal bone. This is the palatal bones, and this is called vomer. Okay, this is called vomer. You have to remember that. Vomer. Vomer forms the lower part of the nasal septum. It articulates with the ethmoid bone on the either side of the vomer are called concave. So it will connect it with the ethmoid bones. Ethmoid bones we seen in the last means in the last skull chapter that it will connect it to the ethmoid bone. Okay, this is the ethmoid bone. Okay, this is the ethmoid bone. So basically the vomer bone is connected to the ethmoid bone. Okay, next the vomer have the concave. So this is the vomer, and you can see here this is the concave. Okay, this is the concave. Six scroll like bones that curl upwards from the side of the nasal cavity. They help increase the surface area of the nasal mucosa. These facial bones are included in table 6.2. So these are the uh, bones of face: mandible, maxilla, nasal, lacrimal, zygomatic, palatine, vomer. Okay. Then other than this, we have the paranasal sinus. So the paranasal sinus, let's talk about that. Paranasal sinus are air cavities located in maxilla and frontal and sphenoid and ethmoid bones. So these are the sinuses which are present in the frontal area, maxilla area, sphenoid area, ethmoid area. Okay, so these are lined with ciliated epithelium. How it is made, how its lining is, it's line. This is the you think it's a sinus. This lining is made with epithelial ciliated epithelium, and we have the mucus of the nasal cavity, and it is continuous with the mucus of nasal cavity. So till the nasal cavity, till the sinuses, we have all have ciliated epithelium. We are aware of our sinus only when they become stuffed up. So whenever you have the cold, running nose, you will your head will have the heaviness. Why that? Because the sinus is filled up with the mucus. Okay, which means the mucus that produce cannot drain to the nasal cavity. This may happen during upper respiratory infection. Okay, upper respiratory infection, you can see here the sinuses. So this is the frontal sinuses because it is near the frontal. That is the reason we call frontal sinuses. You can see here this is the maxillary sinus because of maxilla. You can see here frontal. This is the ethmoid sinuses because of near the ethmoid. You can see sphenoid sinuses. So everything it is because of the passage of free air. Okay, so and as well as to maintain the skull weight very minimum. So that's the reason our God or nature give us these types of sinuses, empty spaces. Okay, so whenever you will get the cold, allergy, fever, these sinuses will fill up. Okay, however, do have function, they make the skull lighter. I told you that the weight of the skull is you're getting nothing but very lighter. Why? Because of the sinuses. Because whenever you have the air, you will pass easily. Okay, and you will give the voice very heaviness. Okay, whenever you want to shout, so this sinuses will make help you to louder your voice. Okay, because of the vibration. Okay, deep of the pitch of the voice. Okay, so we have mastoid sinuses or ear cavity in the mastoid process of each temporal bone. They open into the middle ear before the availability of the antibiotics. Middle ear infection often cause mastoiditis, infection of the sinuses. Within each middle ear cavity, there are three auditory bones, the malleus, incus, and stapes, as part of the hearing processes. These bones transmits vibration from the eardrum to the receptors in the inner ear. So basically, I think here the image is not given. So basically, in the ear we have the three bones. Okay, also called auditory bones. Names malleus, incus, and stapes. Okay, so you can see in the image auditory bones. You can see here that this is the auditory ossils, or this is malleus, this is the incus, this is the stapes. So combined called auditory bones. Okay, in the middle of the ear. Okay, middle of the, this is the middle, this is the external auditory canal, this is the middle ear. Okay, so basically, so this is about our skull. We talked about skull, we talked about facial bones. We have the summary here. You can see bone of the skull. Okay, and here we have the mandible, maxilla, nasal cavity, zygomatic, volatile, palate bone. Okay, whatever the area, how it is connected to other, and the reason, and what is the main function of the bone, you can see here. Okay, so we talked about the skull, cranial bones, facial bones, ear bones, and as well as one supportive bones which support the tongue. Okay, next we have vertebral column. So tomorrow we will discuss about vertebral column, which is very important, and afterwards rib cage, every bone we can talk in detail. Okay, so we will conclude here only. If any doubts, you can ask.